how to identify critical patients. A subscriber asked me, how do I identify critical patients? In this video, I'll answer that question. I got you. So, this is the easiest way to identify a critical patient. Focus on the ABCs and the skin. The way I look at it, if I go to this person's house, I'm first doing scene safety. I'm looking around. I'm also a little bit paranoid, so I'm looking at the corners of the ceiling or on top of the shelf to see if there's any cameras recording me. It's not that I have anything to hide, but nowadays, I don't want to be recorded without my consent. And if I am, then at least I want to know about it. And I'm also looking at this person's effort of breathing, whether they're breathing or not. I'm also looking to see if there's urinary incontinence. I'm looking to see their skin color. Are they cyanotic? Are they red? Are they sweaty? Are they dry? Do they look like they've been laying down for a while? Is there any blood in the area? Like, to identify a critical patient, there's numerous things that you need to take into consideration. Besides the person, you need to look at their surroundings. Are they disheveled? What's going on? Is this person drunk? Is he sleeping off an alcoholic scenario? So, once you gather all this information, start making a mental note of it, especially if it's a crime scene. You don't want to mess up the crime scene, but in most cases, this is just a medical call. And the next thing you want to notice is this. There's certain things that you cannot fake. If a person is bleeding from their anus, coffee ground stools from a GI bleed, or this person's an alcoholic and they got esophageal varices and they got dry blood on their clothes or on their face, you can't really fake that. A person who is cool, pale, diaphoretic, you can't fake that. So the reason why I keep bringing up the faking is because you have people who fake to be a critical patient, but in reality, they're looking for you to give them a medication, or they just have anxiety and a panic attack. Like, this person could be a psychiatric patient acting as if he's dead. Or they'll start shaking and do a pseudo seizure. And one of the ways you know you have a pseudo seizure is you pick up that person's hand and see if it drops. Usually if it drops like this really hard, there may be something wrong with them. But if they kind of stop it and kind of press the brakes on it on the way down, most likely they're okay. So, to identify a critical patient, the first thing you need to do is look at the surroundings. Then realize that a person who looks like they just finished exercising, but has not been exercising, is most likely a critical patient. And what does this patient look like? They have an elevated pulse rates. They're hyperventilating. They're sweating. They look dehydrated. They feel cool to the touch, and things along those lines. So identifying a critical patient is a lot easier than what you think. Just use your patient assessment. Go through the motions of checking for alertness. Are you all right? Are you okay? Check to see if there's any C-spine. Like, basically just go through your patient assessment, and everything that you see on the way, try to address it. So if you're checking for an airway and they have it, perfect, there's nothing to address. But if you see that the person's having a difficult time breathing, boom, put them on oxygen. Or you see that the person looks like they're hypovolemic, like their blood pressure's low, and there's no signs of head trauma, then elevate their legs. Like, grab the cushion right here and grab another cushion and use it to elevate their legs and put them in the shock position while you simultaneously get ready to transport them. Do a finger stick. If you're a paramedic, get a 12 lead, get a your diagnostic capability should be exhausted when prudent. So once again, to identify a critical patient is very, very easy. Just look for things that stand out in the house, in the crib, and then after that, check the patient, the mental status, A, B, C, and take it from there. And always remember, our job is to do no harm and expedite transport. So if you did nothing for this patient besides put him on oxygen and transport him expeditiously to the nearest hospital, you did the right thing. So a lot of times, paramedics and EMTs think that just because they could, it means they should. There's instances as paramedics where you may have a cardiac wheeze or an asthma wheeze and the hospital is so close that you rather just do it at the hospital or as you pull into the hospital instead of doing it at their house. Or you have an intubation, but the intubation is so difficult and the hospital is so close that you end up just doing BVM ventilations with a bag valve mask. So what I'm trying to say is the end goal for an EMT, for a paramedic, is transporting the patient without doing no harm. That doesn't mean don't treat them. All I'm trying to say is that amongst all our priorities, and there's a long list of them, and a long list of responsibilities, the number one priority is being a patient advocate, doing what's right for them, and transporting them to the nearest appropriate hospital. So, that being said, I've noticed that there's a lot of questions, and I ask you to please keep them coming. I will continue to make videos, but I've created a newsletter and a community titled the Advocacy Alliance. This is for committed responders who are also patient advocates, and they want to do right by them. They want to do right by themselves. They want to represent themselves appropriately. So the Advocacy Alliance, there's a form below so you can have free access to the newsletter, and there's also a surprise at the end of the form. All right, my people, peace.